Gynecology at ESMO this year was amazing. We have so much new data coming in. Let's start with the cervical cancer. In cervical cancer, we have seen 3 phase 3 randomized trials. All 3 trials are positive. One trial was in neoadjuvant setting in locally advanced cervical cancer, the Interlace trial, positive both for PFS and OS. The second trial was also in the locally advanced cervical cancer, which was with chemoradiation plus minus pembrolizumab, concomitant and maintenance, and that showed a significant increase in PFS and a clear trend in OS. Data is not mature, we have to wait longer. And the last trial was in the second line of cervical cancer, where patients have progressed on prior platinum paclitaxel plus minus Bev therapy. These patients were treated with tisotumab vedotin or placebo or standard of care chemotherapy, and it showed both PFS and OS difference. So I think we have done something good for our cervical cancer patients this year. In the endometrial cancer, we had results of Duo A trial, which was one of the trials in stage 3, 4, and first relapse patients, which is asking the question of addition of immune checkpoint inhibitors on top of the chemotherapy. And once you are done with chemotherapy, randomizing to plus minus PARP inhibitor, and that is again a positive trial. We have to more distillate the data in the arm C, which is with PARP inhibitor, who are the patients who benefit and who do not, but all together, all intention to treat population, it's a positive trial. Then we had the results of a 10 trial, which is NGOTN7, with chemotherapy in the same population with chemotherapy plus minus atezolizumab, and that also have shown positivity in both of their primary endpoints, which was progression-free survival in DMMR population and progression-free survival in the intention to treat population. However, when we look at the subgroup of MMRP, you don't see that benefit anymore. So I think we have really changed the field for endometrial cancer with 2 solid trials coming in on top of the Ruby and GY018, showing that this is the right path we are on. Unfortunately, in ovarian cancer, we saw another negative trial of immune checkpoint inhibitors. So now we have enough data in ovarian cancer that all checkpoint inhibitors are negative. Maybe there was a hint in Duo O, and we have to wait for maturity of other trials to see if checkpoint inhibitors have any space in ovarian cancer. Thank you.